Hello and welcome to S2S Therapy TV. We're here to support your journey towards better mental health and overall well-being with our latest episodes and expert advice. Here, we dive into a variety of topics related to therapy, personal growth, and well-being. Today we look at common signs of violence in intimate relationships. Intimate partner violence, IPV, is a serious issue that affects individuals in many different ways. Recognizing the signs of IPV is crucial for providing support and intervention. Here are some key signs to be aware of. Physical signs. 1. Visible injuries, bruises, cuts, burns, or other injuries, especially if they are frequent or unexplained. Victims might have injuries in different stages of healing or in areas that are typically covered by clothing. 2. Unexplained medical issues. Frequent visits to the doctor for vague symptoms or injuries that the victim is reluctant to explain. 3. Economic coercion and control of resources by their partner, such as restricted access to bank accounts and spending money, property damage and threats of divorce, reports to police, and deprived access to children. Behavioral signs. 1. Isolation. The victim may be isolated from friends, family, or support networks. They might become withdrawn or seem to avoid social situations or activities they once enjoyed. 2. Changes in behavior. Noticeable changes in behavior, such as increased anxiety, depression, or fearfulness. They may also exhibit a change in self-esteem or confidence. 3. Fearful or submissive behavior. The victim may seem excessively anxious or fearful around their partner, displaying signs of submission or avoidance. 4. Inconsistencies in stories. Frequent inconsistencies in explanations for injuries or absences. The victim might make excuses for their partner's behavior or cover up the abuse. Emotional and psychological signs. 1. Depression or anxiety. Victims often exhibit signs of depression or anxiety, such as persistent sadness, feelings of hopelessness, or severe anxiety. 2. Low self-esteem. They may display signs of low self-esteem or self-worth, feeling unworthy or inadequate. 3. Hypervigilance. The victim might appear overly alert or easily startled, particularly around their partner or in certain situations. Controlling behavior by the partner. 1. Excessive monitoring. The abuser might excessively monitor or control the victim's activities, including tracking their whereabouts, limiting their contact with others, or controlling their finances. 2. Blaming and manipulation. The abuser may frequently blame the victim for problems or issues in the relationship and use manipulation to maintain control. 3. Jealousy and accusations. The partner may display extreme jealousy or make unfounded accusations of infidelity. Relationship dynamics. 1. Frequent conflicts. There may be frequent conflicts or arguments in the relationship, with the abuser exhibiting aggressive or violent behavior. 2. Pattern of abuse. Signs of a pattern of abuse, including repeated incidents of physical, emotional, or psychological harm. Verbal and emotional abuse. 1. Degrading language. The abuser may use degrading, humiliating, or threatening language towards the victim. 2. Threats. The victim may be threatened with harm or other forms of intimidation. This can include threats of violence, threats to harm family members or pets, or threats to take away children. Social and practical changes. 1. Economic dependence. The victim might be economically dependent on the abuser, with restricted access to finances or resources. 2. Changes in work or school attendance. Unexplained absences from work, school, or other responsibilities, potentially due to the abuser's control or interference. Important considerations. Confidentiality and safety. When discussing or intervening in situations of IPV, it's crucial to prioritize the victim's safety and confidentiality. Victims might be in immediate danger, and any action should be taken with careful consideration of their situation. Professional support. If you suspect someone is experiencing IPV, encourage them to seek support from professionals, such as counselors, domestic violence shelters, or legal advisors who can provide appropriate help and resources. Recognizing these signs can be the first step in offering support and intervention. If you or someone you know is experiencing intimate partner violence, it is important to seek help from resources such as domestic violence hotlines, shelters, and support organizations. We're grateful for your support and viewership on S2S Therapy TV. Thank you for watching and being part of our community.